and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the Moses Lake Professional Pharmacy podcast studio, and we are super excited to be talking about PCOS today. Our guest, LJ Johnson, who is an expert in PCOS, was going to be on the show today, and she's having technical difficulties, so we are rescheduling her for Wednesday, so we'll have 3 podcasts this week. But since Jen and I know a little bit about PCOS, we're going to discuss PCOS because it is a question we get often when it comes to hormones. And I'm going to let Janet start off with what is PCOS.
Sure. It's polycystic ovary syndrome. And basically what happens is our body's responding inappropriately in the amount of hormones that we are producing. It can happen early in life. Sometimes the first actual symptoms start when we start cycling as a young woman. And basically what's happening is that we are not having enough progesterone on board to balance the other hormones that we need, such as the estrogen and testosterone in our body. So it leads to a whole host of different types of symptoms. Most likely the person would have irregular periods, whether they're too heavy or very severe as far as cramping, uncomfortable feeling. Sometimes we also associate it with women having really long cycles. Sometimes they will go really long without having an appropriate cycle. And it can interfere with fertility. It can also interfere with daily lives. Many women that have PCOS use or lose time from work just because their symptoms can be severe. And the cysts can be throughout the body. They don't necessarily have to be in the uterus or the vaginal area. So it can be very uncomfortable. And so that's it kind of in a nutshell. Let's start with.
And I'll just add some things to that, is that PCOS, polycystic ovarian syndrome, it might be a misnomer in some ways because not all women that have a lot of the symptoms will have really polycystic, which poly means many, cystic, like bumps, literally. Polycystic, they won't have that. They won't present as that physically. So, but they'll have the symptoms of irregular cycles, maybe some hair growth, because a lot of the women have high DHEA, high testosterone, so higher androgens. The biggest thing is that the women aren't cycling at all, or at least they're really irregular. That's the biggest one for PCOS when I think about it. So since this is PCOS Education Month, that's why we're going to have a couple podcasts on it this week. And one thing I want to reiterate is that PCOS is a metabolic disease. Do you want to go into that, Janet?
I do. Most women, not all, because there are outliers. The doctor that was going to join us today was an outlier. That wasn't her story because we can have thin people that have PCOS, but a lot of times it is actually women that are overweight. And so when we talk about metabolic issues, we're usually talking about, too much weight,
insulin resistance,
and it's fed, of course, because we don't treat it very good in our country. We kind of don't understand it in the traditional sense of our standard of care. And so we don't usually address it with diet. And diet is absolutely one of the biggest tools that we have to address it, even if we are skinny thin. Because if we are resistant to insulin, it just feeds that estrogen dominance issue and pushes those hormones that we don't want over the person's body into places that we don't want. So it's an imbalance that way. And sugar, as far as our processed diet that we have in the United States, where everything that we have that comes from a box or from a chain burger place or any fast food, we're just going to feed the hunger of this disease. So metabolically, it's very inflamed. So that means that it just feeds the pain, the discomfort, the overall sense of not feeling well.
And like most diseases, most chronic diseases that we have in the United States, and Jen and I talk about it quite often, the metabolic type diseases, which most chronic disease is a metabolic disease, which means that you can change it with diet.
Yep.
And Jen already talked about some of the things not to eat, fast food and box foods. And really what you want to eat is you want to focus on protein, real protein, so real meat sources, just real food in general, and you'll be much better off. Now, Janet, let's talk about some of the medical treatments that we have as far as hormone treatments when it comes to PCOS.
So if you end up in a doctor's office, and many of these women do, and they usually come in their early 20s, even teenagers can start with this cycle. Usually what happens is we pull out of the box synthetic estrogens.
Birth control pills.
So we put them on a birth control pill. And that actually is like adding gasoline to the fire, because it really just kind of pretends that you're not pretending that you're pregnant in a way when you're on the birth control pill. And so, it does lessen perhaps some of the lining buildup, but it just feeds the fuel, because that's not the problem. We already have too many estrogen signals being thrown out. So then it leads to more weight gain and more insulin resistance. And so, it's a bad combination. And even if you do have a provider who chooses to use a progestin, which is not natural to our body, it's a synthetic progestin, that doesn't seem to help as well. It might be better than the pill itself, but it doesn't correct the overall issue that's happening. It doesn't change the inflammation in our body. It only just takes and makes the lining a little less, perhaps, or you don't have a period as much, but eventually you will. And so a lot of times these women will present with a lot of pain. So then the next step becomes...
Well, one of the problems is that women usually that have PCOS have cycling problems. And anytime there's a cycling problem, that usually means there's a lack of progesterone.
Yep.
So giving birth control pills, like Janet was talking about, whether it be the synthetic estrogens or the synthetic progestins, they suppress your own endogenous production of hormones, specifically progesterone. Progesterone is progestation. It's a hormone of pregnancy. So when you take birth control pills, it decreases the production of that. When that happens, your PCOS will actually get worse.
Right.
Short term, things might get better. Janet talks about lining, which she means is uterine lining. Short term, things might get better, but long term, it's actually going to make the problem worse. So the important things other than diet are progesterone. I cannot stress that enough. You need progesterone for sure. That's one of the reasons you're not cycling. So give progesterone and enough of it until the woman starts cycling. That's what's important. Once a woman starts cycling, that means she's metabolically healthy again or getting there. So you need to give her enough progesterone to do that. But also thyroid is important. Talk about thyroid.
Oh, 100%. Yes, women need thyroid. And thyroid really helps with your metabolism and energy level, but it helps to balance things too. So if somebody is PCOS, a lot of times they aren't converting to your active form of thyroid, which is T3 or liothyronine. And that's overlooked many times by most prescribers. And we also talked about how many times these women have high DHEA and high testosterone, so acne becomes a problem. So, that's another reason they're pulling out the birth control pills to help treat with the acne. But the cystic acne is not going to be long-term helped with the birth control pill either. The progesterone will. So having metabolism increased, especially when you have somebody with an inflammation, really helps to take the fire down. It takes the fuel down for them. So that is another way of helping them that's natural.
Yeah, for sure. So talk about different dosage forms of progesterone. There's some debate on topical progesterone with creams or oral progesterone
right.
not being absorbed and Go on.
So there's a lot out there, especially in our world, when we talk to different providers that treat with bioidentical hormones, which are hormones that are identical to what our ovaries would make. And many times they will say, well, they have a myth that a cream is much better. It's safer because it's safer on your body to eliminate and you can use less. And over the years, Shawn and I have sat through many different conferences and listened to a lot of people talk about this. But I'm just going to say that most of the women that we see, at least at our pharmacy, that are treated with capsules or oral, seem to respond better. And part of that is because you can get more of the progesterone in them in an oral dosing. And I think that's huge. And the other thing that an oral dosing helps for these women is you can help with their anxiety. You can also help with their sleep. So if I can get a client or a patient sleeping, then their own body's going to heal better. But the myth that I'm trying to debunk that's out there is that it's safer because the path of elimination is going to be easier on our liver. But let's face it, something only is eliminated through our kidney or our liver. And no matter what you use, whether it's a cream or a capsule, if it's a hormone
or an injection,
it
has to go through the liver.
Has to go through the liver. So I think when we approach it as pharmacists, we are looking for what's the end result. And that's kind of what I talk to my team about a lot. What's the end result for the client? And I don't think you can give enough cream to actually get the dose that's going to be effective enough for PCOS.
Right. And I do want to just extrapolate on that. Not everything does go through the liver, only if it's lipophilic, and hormones are most sex hormones are lipophilic. All sex hormones are lipophilic. So, but what I did want to basically say is once it doesn't bypass the liver, only first pass.
Right.
So if you swallow something, it goes to your liver immediately because it has to get into your body. But if you apply a cream, it gets into your bloodstream first, but it'll eventually get to your liver.
Right.
So people that says that creams bypass the liver, it's just absolutely not true. So what about dosing, Janet? What's the maximum dose of progesterone?
So I know you're setting me up for this one.
I am.
So many times I think we get it wrong in healthcare, especially as prescribers and professionals like pharmacists and ERNPs, is that, we always look for that number that someone's telling us it's going to be right. Like, this is what we should follow. But in reality, a dose of medication should be the dose that gets the results that we want to achieve, right? Without the side effects. So, progesterone in a pregnant woman is off the chart, right?
1,000 times higher than it is in a non-pregnant woman.
Right. When we're treating something as serious as PCOS, it really depends on what that patient needs. So you might start them out at a low dose, but you might end up with 800 milligrams, 1,200 milligrams. It just depends on that individual. So it's very distinct to what the needs are of the client and how far and progressed their disease is. Because I feel like if you can catch it early in a younger woman, you probably aren't going to have to be that extreme. But there's no reason to put a huge cap on it. You just have to look at their symptoms, how they're feeling. And it's really easy. If you have too much progesterone, you're going to be sleeping.
Well, you might have some feelings of
breast tenderness, right? It's not, and so it really, there's not a wrong answer to that. I think very rarely do we see somebody overdosed on progesterone. It's a very rare event. So really, what we're saying is, example would be a diabetic that, like maybe a type 1 diabetic. How much insulin do you give, or how much hormone of insulin do we deliver to them? And the answer comes down to what that person really needs, right? To respond appropriately for the therapy that we want to achieve. I mean, what's the end goal? So to keep in mind, there might be a lot of underdosing that happens to these women so they don't get the effects they need.
And we even have we even make recommendations sometimes to use progesterone if needed, on top of their regular dose. If they're having anxiety or sleep issues, they can do a sublingual progesterone.
And this is a real thing. I mean, many of these women will, be kind of talked to a little bit like we need to deal with your anxiety and like it's a mental illness, and it's really not. It's because they have too much estrogen and testosterone in their body, and they're stressed because of that. It's a response because of too much versus progesterone. And many times you give them enough progesterone, it's calming to them. So sometimes, like Shawn says, they can take something throughout the day. And this is where it is a little bit important to know how that delivery should be delivered. So we have some prescribers that will do immediate release throughout the day. And I truly believe that is very important because you want to get those effects into their bloodstream. Some will do tablets that dissolve or troches that dissolve or even capsules. So that's the time where we want them to feel those results very quickly in their bloodstream and in their body.
And then at night, we usually recommend a sustained release capsule, so it slowly releases throughout the night, kind of mimicking how our body produces progesterone. Our body doesn't usually, produce progesterone just all at once before you go to bed.
No.
So we make a sustained release capsule so it lasts throughout the night. Many women that don't use a sustained release capsule will complain of waking up at like 2 o'clock in the morning with symptoms of hot flashes, possibly.
Right. And it's a real thing because most hormones do more than one thing in our body. I mean, we talk about progesterone for our bones.
I don't say this very often, but all hormones do more than one thing in our body.
Most do, yes.
Most? All.
Right.
I will use all in that example.
Okay, I'll do that. Okay, I'm not going to argue that point. So for the sleeping purposes, that's huge because we want that cycle of REM to continue. If we can get the REM sleep to continue, which is facilitated with the sustained because it's more of a steady release throughout the night. That's the purpose of that. Throughout the day, we want it in you and working. So, that delivery is really important because progesterone does affect receptors in our brain, and it does help facilitate that sleep process in a natural way.
So what do we do for women that have one of their symptoms of PCOS, extra hair growth, possibly? I think one of the diagnoses is how large their neck is, but they'll have hair that grows around the neck. They'll have to shave. They'll have extra testosterone, higher testosterone, DHEA. What do we do for those women?
Well, sometimes what we will do is we will give them metformin, and we will also give them spironolactone. Spironolactone is a blood pressure medication that we've learned over time helps lower their testosterone levels. So that helps with that as well. And the metformin helps by lowering the blood glucose. And in the case of metformin, oral use is really hard to tolerate. Most clients will have some GI distress from it. So there's actually topical that works super well, and you can get higher doses that are tolerated better. So the combination of those two help with those side effects of having too much of the testosterone and DHEA in their body.
What about berberine as natural metformin?
Berberine is really good about lowering our glucose levels naturally. I caution people because it's a tool and it helps, but you still have to approach it from the diet side. We talked about that first because if you have an inflammatory problem and you take a supplement or even a medication like metformin to lower your glucose, but you do nothing on the diet side, that's not going to work.
Well, and that goes no matter if it's berberine or metformin or whether you're on thyroid and progesterone. It's like, hormones or medications are just tools to help you become metabolically healthy. But the reason probably most people became metabolically unhealthy in the first place is because their diet was not appropriate. Now, obviously with menopause, as we age, our hormone levels just naturally decrease. So some of the symptoms that come on as we age with hormone-related symptoms are something that is just inevitable. That doesn't mean that we can't help get through those symptoms by taking better care of our bodies.
Mm-hmm. Yeah. So there's other treatments that women end up with, Shawn. I'm thinking about injections. for PCOS. So we haven't really talked about Depo-Provera. Sometimes women will end up on Depo-Provera.
I forgot about that one.
Yeah. You want to talk about that one?
Yeah. Depo-Provera is, Jen already talked about it in birth control pills, the synthetic progestins. Depo-Provera, Depo meaning long, depot means it lasts a long time. And it's a synthetic progestin that it's injected every 90 days to help for, it's usually, it is, indicated as birth control. But they'll use it long term sometimes to help for PCOS. And again, the problem is you're just masking the problem. Mm-hmm. You're actually stopping your own endogenous production, your own inside production of your own hormones when you give those synthetic progestins. So it actually stops your own progesterone production and makes the problem worse over long term.
Right.
That is one drug I would never ever recommend. As people that specialize in hormones, we see so many side effects from that years later after women have been on Depo-Provera and the birth control pill for that matter.
Right. So unfortunately, if you're good enough to get through that part. The infertility thing that starts happening with these women is really sad. I will speak to this because I have firsthand knowledge with family members that suffered from PCOS up until menopause and multiple miscarriages, which is just heartening. And you just kind of feel for these women because they're totally mishandled. Many times what happens is that first trimester, once they get pregnant, if they can get pregnant, the miscarriage happens because they cannot produce enough of their own progesterone to maintain that pregnancy, which is actually one of the functions and jobs of progesterone, just like the name, like Shawn spelled out, progestation. And in our system today, you would be hopeful that your doctor or OB would understand that you need progesterone, but they don't. So many times that is a tragedy that they go through. And then the second thing that might happen to them is if they're in a situation where they have found somebody to help them with their hormones and treat it, they go in, they're pregnant, and the first thing that their doctor will say is, stop taking that progesterone, you're pregnant. And it's like, that's the last thing on earth you want to do.
There's so much ignorance in this topic. It's
man.
We have seen women that have fertility issues based on PCOS many times. Excuse me. And they go to fertility clinics, spend tens of thousands of dollars. They never ever had their progesterone level checked, and they finally throw up their hands and they come see us, and we recommend they go to a provider that prescribes progesterone. Yeah. They get pregnant within 8 weeks. This has happened more than a handful of times.
Many
they
times.
Get pregnant within 8 weeks, and what does the primary care doctor do after somebody gets pregnant? They need to refer them to the OB, and the OB says, well, you need to stop the progesterone, and then the person miscarries.
So
over and over.
Totally tragic.
It's so sad.
Yeah.
And it just shows you how much ignorance there is about hormones in the medical field.
So if you're lucky enough to have a pregnancy and maintain it, and you get through that, which some women can, I mean, it's amazing how our bodies can do that. Then the next step becomes what, Shawn?
If you maintain the pregnancy?
Well, after you've had your kids and you're mid 40, what's the next scenario that they face?
I mean, they're going to start having irregular cycles. You're putting me on the spot here.
Yeah. So what's the next therapy that we pull out of our box for?
Yeah, I know.
What's next?
Right. So
on the
the next therapy after you've had your kids, and then you've had PCOS, and you had problems having kids, and now you have this kid, then all of a sudden it's like, well, you don't need your body parts anymore. Right. You just need a hysterectomy.
Yep.
Or an ablation.
Right.
Ablation. Oh, that wasn't enough. Okay, we'll just take out your body parts. And Janet likes to remind people that anybody that's had a hysterectomy, it takes 10 years off your life.
Yeah.
Boom,
10
just like that.
years.
10 years.
And the sad part about it is not only do they say, oh, this is going to fix the problem, right? And I've heard it probably 1,000 times, and I probably hear it once a day, if not more. So the lady goes in and she does everything she's supposed to. She has a hysterectomy, and for a little bit, she might be okay. But pretty soon, we still are having the same type of issue repeating itself. And again, having a hysterectomy does nothing for that lack of progesterone or for the dietary issues that need to happen along with this. And you still are going to be producing DHEA and testosterone. So here you have somebody that's went through all these things and a surgery on top of it. And then we're going to tell her, well,
sorry, that didn't work.
Yeah.
So what's the next intervention? Let's take out your ovaries now.
Well, we should probably give you antidepressants.
Oh yeah, give antidepressants. That's one.
You might feel better because
you start having urinary incontinence after you take out your ovaries. So we'll give you, things for urinary incontinence and things for your vaginal dryness
and your anxiety. We'll treat that.
Then your bones get weak, and we'll give you things for your bones. But I'm so glad that we took out your uterus and your ovaries.
So I can tell that we're a little sarcastic, but the sad thing about it is that that sets this person up for osteoporosis. It sets them up for chronic UTI issues. You set them up for prolapse. You set them up for cardiac problems. I mean, the list goes on and on. And if we had treated it with the root cause of the disease,
like most diseases, it's a full body disease, like most all diseases. That's why we said it's a metabolic disease. It affects your entire body. So taking out one body part is not going to fix it. It might just fix a few symptoms
for a while.
For a while,
for a moment, if you're fortunate enough. And if you have spoke to any of these women, it is very heartbreaking to me because they almost get to a place like, we've done everything for you. What's wrong with you? Why are you back in here? Like, why are you, and the sad thing about it is it's because we've totally misunderstood the root cause of this disease. And, I know we talk about diet and inflammation a lot, but that is a root cause to a lot of problems, and it's fixable. It's something that you can do. Obviously, everybody's a little bit different and not everybody responds the same, but guaranteed, if you got rid of the things in the grocery store that are in the middle of the grocery store, the boxed foods that are full of sugar and all the processed flour and all that, and actually return to foods that come from the earth and are closer to that, such as, our own fruit and vegetables that we grow and meat, even fat. I mean, that's the other thing that in most,
fat.
Shawn and I went to school when we went on the big carb thing, low fat, low as far as low as you can, so buy the low fat, whatever. And it's like, no, that was the wrong answer.
And red meat's bad for you. Yeah, dairy's bad for you. Eggs are bad for you. What a joke. I can't believe I thought it.
Well, it's part of the process of, actually, we need to take back our food sources and make our food choices. And Shawn and I will talk about this a lot because there's such a misunderstanding of what food costs. And for example, we went over the weekend and we purchased our fruit and vegetables at a store that actually gets it fresh from the farm, and it's really healthier, tastes better, it's fresh
and inexpensive.
So, we have farmers market in our town too. It's at different times, but many cities have them. There's fresh markets. It's so much better for us. I'm not somebody that believes that you have to do one diet 100%, but in a PCOS person, you need to get away from the processed stuff. You need to get rid of it, and don't let anybody tell you that, whey protein, because I'm going to harp on this a little bit. You need real protein, and I know whey is real, but what comes along with it in our society is that we have to put this to make it taste better, and this, so eat the real food and eat it because it's healthier than, I'm trying to say fast food, but convenience food is the term I'm looking for.
Exactly.
Convenience.
Absolutely.
You can't replace, a hamburger or a steak or an egg or fish, for that matter, in a whey protein bar. I know it's sometimes necessary, perhaps. Maybe you're traveling, or we have two big men for boys. Which they don't want to be called boys, but men that their caloric intake for how they work out is higher than most, but for most Americans, and especially women, throw the whey away.
You don't need extra. You don't need to supplement with extra protein. Eat real food.
Real food, please. Real food.
In most instances, that's the truth.
Yep.
So as we wrap this podcast up, I just want to let you know that we, we stream live on Facebook, LinkedIn, Twitter, YouTube. So please go to those platforms, like it, share it, subscribe, whatever you're supposed to do on those platforms. And we really appreciate it. We are going on our 500th episode here in about a month. And we are super excited to be educating and empowering individuals all over the world. That's been our goal with this podcast, and we'll continue to do so. If anybody has any questions about PCOS, please call our pharmacy. Sarah's going to stream the number there. Moses Lake Professional Pharmacy. We've been in business for almost 26 years now. And we love answering questions about hormones. So please feel free to reach out, 509-764-2314. And as always, thank you for listening to Health Solutions with Shawn and Janet Needham. Tune in Wednesday. I'm not sure what time, but check our social media, because you'll find out that LJ, who could not be on today, Dr. LJ Johnson, will be on Wednesday to share her expertise on PCOS. So thank you for tuning in to Health Solutions with Shawn and Janet Needham. Thank you.